On 30th January 2025, the Ministry of Health confirmed the outbreak of Sudan Ebola virus disease in Kampala following the death of one male individual who was working as a nurse at Mulago National Referral Hospital, leaving over 200 contacts isolated in Mulago and Mbale isolation centers.
A confirmed case designated as the index case is a 32-year-old male nurse who was an employee of Mulago National Referral Hospital, who initially developed flu-like illness and fever symptoms and sought treatment at multiple health facilities.
Today, the Minister of Health, Dr. Jane Ruth Acheng, has discharged 8 of the cases who have been receiving treatment from Mulago International Referral Hospital Isolation Facility and Mbale Regional Hospital. She revealed how more 265 contacts are still under quarantine until their 21 days of exposure to the index case lapses.
7 of them received treatment at Mulago National Referral Hospital Isolation Facility, and 1 received treatment from Mbale Regional Hospital Isolation Facility. Furthermore, 265 contacts are under strict quarantine and monitoring at Kampala, Jinja, and Mbale quarantine facilities.
Acheng indicated some of the response measures undertaken by the ministry to contain the virus.
Is tracing and quarantining all identified contacts. 2 is strict monitoring for signs and symptoms of Ebola virus disease. 3 is isolating symptomatic contacts and testing their samples for the virus. 4 is heightened nationwide surveillance efforts and intensified public health risk communication and community engagement.
Regarding the mpox disease, which was declared 6 months back, Acheng says the situation is still alarming as the total number of confirmed cases stand at 2,896 and 19 confirmed dead in 81 districts. She called for vigilance among the public.
87 districts have reported at least 1 confirmed case of mpox, and the total number of confirmed cases is 2,896, out of which 19 unfortunately died. The majority of the deaths were among individuals with underlying conditions such as HIV, tuberculosis, and sickle cell disease.
The minister, however, recounted the deliberate misinformation regarding the ongoing outbreaks, which she says would complicate public health response and efforts.
I want to particularly comment on the misinformation that is always posted on social media regarding outbreaks. And I want to quote, because those who post keep on saying that the Ministry of Health is looking for money. And particularly, they target the accounting officer and the Minister for Health, saying we declare outbreaks whenever we have run out of money and we want money for ourselves.
Dr. Kagwa David, the unit in charge, appreciated the government for establishing modern facilities to cater for the patients of Ebola virus disease.
To thank the government of Uganda for constructing such a good facility to care for Ebola. Many times we care for Ebola in tents and makeshift structures, and it's very difficult. It's very difficult to work in the mud and heat. And this structure is very good, believe me.
Some of the survivors of the Sudan Ebola virus disease shared their stories and appreciated the government for the services rendered towards their well-being.
On behalf of the survivors, I really want so much to appreciate and convey my gratitude to the team, regardless of the cadre, be it a cleaner or a medical officer.
The World Health Organization representative to Uganda, Dr. Kasonde Mlenga Mwinga, commended the government for the swift response and pledged continued support.
What has the government of Uganda shown in this 8th Ebola outbreak? It has shown remarkable leadership, by quickly identifying cases, quickly establishing treatment centers, and working closely in coordination with partners.
When asked on whether the US funding freeze has not affected their efforts in combating the outbreaks, Dr. Cheng responded this way.
The funding cut by the US affected efforts to monitor Ebola and to control it? My answer is no, it did not. And I will explain to you why. First of all, allow me to appreciate the US government. In spite of the challenges that they have been facing, the US government did support the Ebola outbreak.
John Baptista Humza, Church of Uganda Family TV News at 8.